Let's take a few minutes to talk about IONM. You may have heard of IONM before, but we promise that by the end of this video, you will have a greater understanding of not only what it is, but how it is beneficial in various surgical procedures. If you're a patient going into surgery, there will be many monitors in the operating room serving multiple purposes. They will be monitoring your vitals, your heart rate, and your body temperature. There may even be one that gives the surgeon a 3D image of your anatomy, and you might also see a screen devoted to the real-time surveillance of your nervous system function. It looks like this. The screen contains intraoperative neuromonitoring data, or IONM, which is real-time data coming from your brain, spine, and nerves. It is now standard practice for many procedures in which these neural structures are at risk. Aimed at reducing the incidence of post-surgical neurological complication that can occur when you're working around the important neural structures and vessels that feed them, IONM helps to ensure a positive surgical outcome for each patient. The benefits and type of IONM can change depending on the procedure. The surgeon, the oversight physician, and the surgical neurophysiologist, your IONM team, work together to devise a customized monitoring plan to fit the needs of each individual patient. Let's look at some examples. During spinal procedures, the spinal cord and nerves branching off the spinal cord are taking up real estate within the surgical site. Often these structures need to be manipulated or are in general risk of being injured during the surgical process. IONM allows the surgeon to have real-time feedback of nerve activity and sensory and motor function of the spinal cord. It helps with proper positioning of spinal screws and stimulators. It can also help the anesthesia team identify your preferred positioning and blood pressure. There's a reason the saying goes, it's not brain surgery for a seemingly basic task. Brain surgery is complex. Your brain contains a significant amount of important tissue and cranial nerves that, if disrupted during surgery, can have a large impact on your quality of life. By using IONM during these surgeries, proper blood flow can be assessed. The patient's language areas of the brain can be identified. The motor cortex can be mapped out for preservation, and injury to cranial nerves, such as the ones that control your facial expression, can be avoided, allowing the surgeon to have peace of mind when focusing on the very important task at hand. Procedures involving peripheral nerves also benefit from the use of IONM. These surgeries involve nerves that are close to or run through the surgical site, such as many ENT cases, or involve nerve plexuses, the spider webs of nerves that help control the limbs and serve as communicators back to the spinal cord. Whether it is a nerve tear repair that occurred during delivery, or determining the path of the nerve running through the thyroid gland during a thyroid procedure, IONM can again be useful to determine nerve function and avoid further injury. Not only that, but IONM is used to ensure that you have continuous blood flow in intracranial procedures such as aneurysms and AVMs, or extracranial procedures such as carotid endarterectomies. It can even be used in heart procedures. Beyond all the benefits we just discussed, IONM continues to evolve and grow in utilization, helping unintended surgical complications become a thing of the past. And you can rest assured that IONM will help the surgical team provide the best possible patient care for you and your loved ones.